I actually wanted to become a surgeon, which is how I ended up becoming a physician. And a lot of that stems back to over the years, I've done a lot of really sort of intricate artwork. And to me, that's what surgery was. So surgery was first, medicine was second. I've liked the whole idea of having a problem and fixing the problem. So I don't do as much intricate artwork anymore. However, every year I do make a gingerbread house. So if you see the obsessive compulsiveness of that gingerbread house, you'd understand how I answered this question. And I like the fact that it's not a static profession. There's always something changing, so it's always challenging your mind. So it's persisted.
My brother went to medical school and I followed his footsteps. I like to read. I always like to learn. And I learn from my patients every day.
As you can see from this drawing that I did when I was in second grade, it already was something that I was thinking about. So I began working as an X-ray cart boy in 10th grade. I had a little badge that said Eddie Knight's X-ray cart boy, and I was in transportation moving people up and down in the hospital. So that's how I got my start.
For the hospital years ago, it was a major center for acute care. Now it's evolved to preventive medicine, wellness medicine, acute care, and then after that, follow-up transition care to skilled nursing facilities and to home care, with alliances to tertiary care if needed. But that's a huge change in the role of the hospital.
A lot of changes have happened in medicine since I started. Doctors used to carry a bag, now they carry a laptop, a tablet. Oftentimes patients ask me about prescriptions at the end of the visit and are surprised when I tell them it's already at the pharmacy.
Most of the work that we did in the concussion field for decades was done in the sports medicine field. Now, sports trauma is a big part of neurology. Concussion work is a big part of neurology and neurosurgery to an extent today. And of course, there's just been an explosion of interest in that field.
For Acton Medical, it's just the camaraderie, the high level of medical care that I think that the pediatricians provide has just been exceptional. Since we're not directly in the hospital, we have the pediatric hospitalists to take care of our patients, and it's been wonderful. We have a wonderful relationship with them. We trust them, we communicate with them, and the system that we were unsure if it would work works very, very well. And the patients get excellent care there because they have a pediatrician with them 24/7.
Through the years, we've had wonderful CEOs with great vision who have kept at the top of that vision providing the highest level of services. And it's kind of fun to think back that arguably the CEOs with the longest tenure and the perhaps the greatest influence were all women. It's just a wonderful, wonderful atmosphere and place to be.
The ways that they've helped us have better outcomes for our patients, it includes providing us with radiology services. We were having to hire our own radiologist. I wanted to get a hospice started. Emerson was right there. When I was the chairman of the board of the Elliott Mental Health Center, they helped me a lot with coordination of the care back and forth between outpatient and the inpatient units. So those were all important reasons why I wanted to stay a part of Emerson's.
I'm probably most thrilled, obviously, to be a part of the Concussion Center that bears our name and be working with nearly 40 people at the center. But I would just hope that other people in medicine today, with the challenges that we all have, could have the good fortune to be half as excited about the practice of medicine and the wonderful work that they're doing as is the case for me.
Our patients are dependent on the PIT team. We reach out to the PIT team. We need them desperately. They are so wonderful with the children. They prepare them for any studies, a CAT scan, MRI, anything that they might be afraid of.
I really like the nurses at Emerson. Everyone goes out of the way beyond their job description to help out whenever they're needed. They put the extra effort in. It's just a pleasure. The floor nurses I find are very smart. They think problems out. They call you when they have concerns. I respect their judgment.
Emerson's a very special place in terms of its culture. A culture of caring, and it's caring not just for the individual, but caring about the whole institution and how to care for patients. And that's pretty striking. It's also striking in terms of being conscientious. So as a result, you've got a sophisticated staff, capable staff, a hospital that's there to provide the kind of care that you really want if you are a patient or a provider. So I feel very fortunate to have ended up here and had the opportunity to practice at Emerson.